back with Dr. Chatterley. Dr. Chatterley, tell me, as patients out there, we sometimes have a little question and a confusion maybe. Let's assume we have a couple, 2, 3 teeth missing, usually in the back, where it's not so visible. Front, we run to a dentist right away if you have a tooth missing. But anyway, in the back. And apparently, Dr. Chatterley, apparently nothing bad is happening. And yet, dentists keep telling us, you got to replace those teeth, otherwise all, hell breaks loose. Can you shed some light on it of what this discrepancy is? Really nothing all that bad happening in our mouth, and dentists are pushing us to do it. Is it, tell us why.
Well, when you recently lose a tooth, changes very slowly and subtly begin to happen. Time will go by, the tooth will shift, the space will change. It leads to the tendency to develop periodontal disease around that tooth when it's shifted and out of position, and then the bite can change. And if there's enough teeth lost and enough shifting, then it can also affect the joint, the temporomandibular joint, which when it's out of order, we call it temporomandibular joint dysfunction. So it may not be immediate.
Is that this joint here? Is that kind of why they basically the hinges where our teeth kind of flat? Okay.
Right, the hinges at the corners. It's actually the most complex joint of the body, so it needs to be balanced. So the changes are slow and gradual, but the earlier things are repaired and the bite and dentition is completed, the less apt they are to develop. So that's why a dentist would be coaxing you into considering replacing a missing tooth or teeth.
I see. So basically, what a dentist does is like what parents do with their children, coaxing them into, doing their homework, knowing that if they don't do it, all hell will break loose when they grow up. Something like that.
Something like that.
Something like that. So basically what you're saying is when you lose a tooth, the tooth is not supported, like a fence, we have all those fence poles and one is missing, then all of a sudden they get all kind of crooked.
Good comparison.
Yeah, and then so number one, it may look ugly. Are they also going to shift other teeth then who are next to it? Like if, because on a fence pole, if one pole goes, it shifts the other one also.
Not only do the teeth shift on the same arch or the same area, but the teeth below will begin to shift because the teeth always seek an antagonist to rest against and to bite against. So they will continue to move. Right.
Now, so when that happens, obviously you're going to lose more teeth and you're going to look ugly before that happens. It starts looking crooked like a fence. So that fence becomes unfunctional. Basically every dog can come in and out, in your garden, and it looks ugly. Now, you said that, the joints are shifting. Now, I'm a mechanical machinery engineer from my early profession, and unlike you still doing dentistry, I don't do that anymore, but I've learned that when cogwheels or hinges are out of alignment, it puts all kinds of stress left and right. So if that happens here, wouldn't that put tension on your neck, on your shoulder, and maybe even on your head?
Absolutely. There's 5 sets of muscles that are directly involved with the opening and closing of the bite. But all the head and neck muscles are correlated. And so if the bite is off, see the joint, the temporomandibular joint is the only joint in the body that's dictated by other than the vagal nervous system that automatically tells you when you stretch your arm out and you're able to get stretched so far, the elbow tells the brain, okay, don't stretch me anymore. But the temporomandibular joint or the jaw joint, it's the way the teeth come together. So if the bite is shifted, then gradually that shifting is compensated for, and then over time it can lead to temporomandibular dysfunction and the pain associated and the dysfunction, not a pleasant situation.
yes, so will it give you shoulder pain, neck pain, and headache?
Shoulder pain, neck pain, headaches, they all can be associated and are caused by temporomandibular joint dysfunction. They're come in consequence of the joint getting out of alignment and out of function.
Mm-hmm. So let me ask you, a person who, let's say, has stiff necks and shoulder and maybe some headaches, and he has tried a chiropractor, did a few things to fix it, but really couldn't fix it. Would it be wise for him to go and say, let's go to a dentist and see whether my chart joints are out of alignment or overall the bite, as you call it, the whole thing is not quite aligned? Would it be a wise thing for him to give that a shot and find that it is, or eliminate it as the cause? Would that be a good thing?
Definitely be a good thing. It'd probably help resolve the conditions and the symptoms they're having, but if they're able to correct it, but to detect it, yes, definitely. The longer that it goes without, being addressed, then the worse it'll develop.
Wow. So yeah, it is always quite amazing to see how, the body is really built as a system and as a synergy. And I mean, here you have this mouth, and next thing you know is you get headaches and neck pains from it because of it. And when you have those things, life becomes difficult. It's not anymore about having a missing tooth or so. It's about, having a headache when you're supposed to concentrate and do work. And then you wonder why your career just simply isn't going quite as well as it could. Or at least you're not enjoying life and dinner with whoever, your kids, your parents, your friend, your wife, as much as you should. Well, I appreciate your candidness. I appreciate your informative explanation on here. Thank you very much, Dr. Chatterley.
You're welcome.